Assalamualaikum warahmatullahi taala wabarakatuh. We are from Group 14 and we will discuss about contract doctors in Malaysia. This issue had arisen significantly in Malaysia last year as there was a move from the contract doctors to show their unsatisfaction towards the policy that been implemented by the government. This move was called Hartal Doctor Contract. This move happened because they thought that the policy that been introduced by the government like contract medical officer appointment policy give injustice to their future where there is no guarantee on the absorptions of the doctors to be permanent. Currently, there are more than 20,000 doctors work without permanent position despite playing a key role in the fight against the health of Malaysians, especially during the COVID-19 outbreak. The bodies that involved in determining the future of these doctors' contract are the Ministry of Health, Ministry of Finance, Public Service Department, and Malaysian Medical Association. These bodies have their own role to ensure that the voice of the contract doctors can be made into reality.
Assalamualaikum everyone. My name is Muhammad Irshad and I'll be presenting the analysis of issues. There are three main issues that arises from the issues of contract doctors in Malaysia. The first one is contract doctor system is a short-term solution introduced by the government back in 2016 by the sixth Prime Minister Dato Seri Najib Muhammad Razak. The system was introduced due to the increase of medical graduates while permanent doctors' position in public sector was limited. The increase of graduates was also due to the obsession of previous government in increasing the ratio of doctors to the population. Currently, the RMK12 targeted ratio of doctors to population are 1 doctor to 400 citizens by the year 2025. However, this ratio was originally targeted to achieve back in year 2020. The question that arises is why contract doctors are not being promoted to achieve this ratio back in year 2020. Next is the issues of no transparency in promotion. From December 2016 to May 2021, approximately 23,077 contract doctors have been appointed. However, only 3.47% or 789 contract doctors are being promoted to permanent position. This shows that only a few numbers of contract doctors are being promoted. So, what will happen to the contract doctors who are not being promoted and their contract expires? The government has no obligation to continue the contract doctor services. In addition, the Ministry of Health has also not set specific criteria on how the contract doctors can be promoted, whether they are being promoted based on their performance or there are other criteria set by the MOH. This is something that the MOH need to look into. And lastly, the issues of unfair policy towards the contract doctors. Contract doctors does not have the same right as other public servants. They do not have maternity leave. They do not have study leave. They does not even have housing scheme loans. They also need to bond medical training costs by themselves. They are also not given the same opportunity to become specialists because admissions to master courses in public institutions of higher learning is limited to permanent public servants. This shows that contract doctors are not being treated equally like other public servants.
So, what are the effects of offering contractual positions for the young doctors in the public healthcare sector? One of them is that these doctors will not have the sense of job security and might consider to leave the public sector and enter the private sector or even leave the country. Besides, doctor is a highly demanded profession and high-paying jobs in the developed countries. This can be illustrated from a data that shows that doctors in developed countries such as America and Europe are offered with higher pays as compared to a developing country such as Africa or in our case Malaysia. So high pay and coupled with the fact that there is no serious solution taken by the government to solve this problem of job security, all the more reason for them to leave the public sector. While according to this article that states that Malaysia have met the target of doctor to patient ratio suggested by the World Health Organization, the current efficiency level of the public health sector is still somewhat questionable. The long queue to even have an appointment with a doctor is very time consuming. Keep in mind that this is not getting a treatment yet. Remember that the government and public sector are supposed to serve the public. which in this case offering accessible and good healthcare. If this problem continues, then it shows that the government is not properly doing their job. Thus, the concern of professionals leaving the country, where some would refer as brain drain, poses a serious threat to the public healthcare sector. Another problem is that the short period of time that these contract doctors are serving in the field hinder them from taking the master program and become a specialist. This will eventually result in a low number of health specialists in the country.
Hi, Assalamualaikum. So I'm presenting on the initiative on the issue of contract doctor in Malaysia. So before that, President of MMA, Dr. Koh Karchai, expressed his disappointment with the government decision in Budget 2022 proposal, since nothing significant is reflected to address this issue, even it had been arose before and majority of the cabinet were aware on this issue. So the two initiatives by Ministry of Finance are propose extending contract for 10,000 trainee doctors, dentists, pharmacists, and by an extra for 2 years. And then second one is allocated 100 million to sponsor 3,000 medical officers and dental officers to pursue specialist courses. So these initiatives are set to benefit a mere fraction of the contract healthcare workers nationwide. However, instead of contract extension, what specialist group like Hartal doctor contract, one is a more permanent position and specialization opportunities. So now we move on to the next initiative from Ministry of Health, which are first is allowing contract doctors the right to apply a full scholarship, which is hadiah latihan persekutuan under the Health Ministry to pursue their specialist training. And then the second one is 8,000 permanent position for health practitioner from 2022 until 2025 will be created. So from this initiative, we can see that HDK expressed their gratitude to Health Minister for this opportunity, which really helped them to pursue their career as a specialist. Besides, government's aim of increasing the number of specialists in public healthcare had received positive response from the contract doctors. So they also believe that the other issues like transparency criteria and selection of contract doctors to be absorbed into permanent posts can be solved in the future.
My name is Muhammad Hazim bin Abdul Hadi. So now we're moving on to the recommendation part. One of the methods to solve the problem is government can restructure the system. It will start with the education system of medical students. Government should increase the minimum requirement to enter medical school, which is from 5B to 5A. So, government is able to reduce the number of applicants of medical school. Thus, it can balance the demand and supply for doctor in the future. Next, government should improve the current system by giving equal right to contract doctors. For example of right to equal salary and benefit, right to postgraduate training or specialist training, and also right to secure their future. This can be related to the SDG goal number 8, which is decent work and economic growth. The contract doctor will have same opportunity as other doctors. They can build their career and have motivation to be successful. The recommendation also in line with the SDG number 8, which is to protect their rights as a labor. Okay, last but not least, this issue can be related to Maqasid Syariah, which is the protection of life. There is a saying stated, saving the life of one person is as if the life of all humanity is safe. This issue must be addressed properly to ensure our health system will run efficiently and smoothly, especially during this pandemic time. COVID-19 has caused many deaths. Our healthcare system must focus on the COVID-19 to protect people's lives.
It is important for the government of Malaysia to solve this problem to ensure that the stability of this sector, as it is one of the crucial sectors in our country. We hope that this problem can be solved accordingly by the authorities to the best interest of Malaysians to create a better nation that follow the SDG as well as the Maqasid Syariah. That's all from us. Thank you.